This is the weight loss drug Wegovy. So is this. They're identical, except for the price. In Britain, Wegovy costs about $135 a month, but in America, its list price is 10 times as much. Donald Trump has had enough of America's sky-high drug prices.
What the hell is going on? The same box, made in the same plant, by the same company. We've been subsidizing other countries throughout the world.
He wants to force drug companies to peg their prices to the lowest charged in other rich countries, a rule he calls most favored nation pricing. He's got a point. America accounts for about half of global pharma sales, but 70% of profits. That's because Americans pay more than 3 times the average of other rich countries for their drugs. And that's because of how the market is organized. In other countries, governments negotiate directly with drug makers, using their hefty bargaining power to secure cheaper prices. But in America, prices are set through a maze of contracts and negotiations between drug makers, insurers, and middlemen like pharmacy benefit managers. And because those middlemen are usually paid a percentage of list prices, there's little incentive to keep costs down. But Trump's plan could backfire, leaving Americans with fewer drugs, but not cheaper ones. To protect their profits, pharma companies could simply raise their prices in other countries to push up the benchmark. They could alter formulations to make international comparisons harder, or they could simply delay launching new drugs in cheaper markets altogether. None of these strategies would make drugs any cheaper for Americans. And these aren't hypotheticals. A 2023 study found that the introduction of similar rules in Europe delayed drug launches in poorer countries. It concluded that trying them in America would have little effect on US prices, while limiting access to new drugs in lower-income countries. The reality is, America's ballooning healthcare prices aren't entirely the fault of Big Pharma. Drug makers take big, risky bets developing new treatments that can take decades and billions in research costs to bring to market. When around 90% of clinical drug development ends in failure, they need to recoup their costs on the successes. Slashing their profits would leave less to reinvest in creating new cures. The real problem lies elsewhere. In 2024, drug sales in America surpassed $1 trillion, but manufacturers made less than half of that after discounts and rebates. The rest went to middlemen. Encouraging more competition in the rest of the supply chain would be more likely to bring prices down for consumers without risking innovation. America's drug market is broken, but Trump's cure could end up being worse than the disease.